ADR, this is King Black, and I wanted to pick your guys' brain a little bit. I titled this video, Brain Surgery or No. Now, for those of you who don't know, I have two herniated lumbar discs, my L4 and L5, S1. Our vertebrae is severely herniated and currently being treated, you know, at the VA. And, they don't really want to do back surgery right now because they're saying I'm too young for it. But the best they want to do right now is continue pain management. Even though this is something that I've been dealing with almost for a decade now. And I've been on everything. I've been on Percocet, Tramadol, Flexeril. I have even been on Lorcet. So I've been on some pretty heavy stuff. And, when you're taking pain meds, your pain tolerance starts to increase. And I remember at the worst of it, I was mixing 3 or 4 different types of pain meds. I was mixing Percocet with Flexeril, with Tramadol, with some aspirin, and taking like 8 pills every 6 hours. Even though, based on the dosages they were giving me, I was only supposed to take maybe half of that every 6 hours, 6 to 8 hours. And I would feel no pain, but I would be high as a mother, I would be on my bunk, just spaced out of my mind. But I was never addicted to them in the sense that once one prescription was over, I was in a hurry to go get another bottle. The reality is I got hurt while I was younger, and I always wanted to live a normal life. Even though I'm dealing with chronic pain on a daily basis. I have sleep apnea because of it. I used to weigh, something like 140 pounds when I was in the service. Right now I'm pushing 2 bucks, 200 pounds, 180, 195. I'm not supposed to be running long distance anymore. Can't be lifting anything heavy. Can't even lift up my own kid. That's how bad it is. This is somebody who hasn't even hit 40. So my question to all of y'all is, do you think a back surgery is worth it? Do you think it will make a difference at all in my day-to-day tasks? Will I be able to pick up my kid who weighs something about 40 pounds right now? Will I be able to have range of motion? I've heard both sides of the story. I've talked to other veterans and people who have had back surgeries done, and many saying it didn't make a difference, or that their pain got worse, or that if I decide to get it done, I shouldn't get it done through VA. I should get it done through a private service provider, go to my own private doctor and get it done. So a lot of people hate on VA when it comes to surgery. So anybody out there that has had back surgery done to correct herniated discs, let me know in the comments. How did it go? Is it worth it? Should I even attempt it? Since I'm not even 40 yet, but on the plus side of being younger is that maybe the bones and the cartilage will have a better chance of healing. But back surgery is a major surgery, man. It's mad scary. Whenever you no matter how simplified they've been able to make the procedure over the years, over the decades, it's still scary to think that somebody's going to be in your back. And that's where you have your spinal cord, and you're always scared that they're going to make you paralyzed from the waist down, or they're going to mess you up. If I was able to see the future, and I would see that I was going to come back worse than what I am now, I would rather not have it. But at the same time, if I have the prospect that it may get substantially better, that I don't have to depend on pain meds to get through my day, because I can't quite describe the feeling. Like, I don't remember how it feels to be normal. Like to have a normal back, to be able to squat, to be able to kneel down. My nervous system is all messed up. My bones ache, especially on a cold night. I'm like an old man trapped in a young man's body. There's a toll that your body takes when you enter the service, and either sooner or later it's going to come out. And for me, it happened sooner than later, and it just continued to stay the same and get worse in different aspects. When I first got out of the service, I had really bad pain, and then I moved on to a whole bunch of different narcotic level painkillers, your Percocets, your stuff that you can't get that easy. Then I went to therapy, but also because my hip is also affected, it put a damper on my physical rehab, because I couldn't do the stationary bike, because at the same time it was hurting my hip. So they didn't know what else to do with me. Then they did ultrasound treatments, and it would make me feel better for a couple hours, but then the pain would come back. Tried giving me cortisone shots, no difference, same amount of pain. Still dealing with sleep apnea. I sleep maybe 4 or 5 hours, even with sleeping pills, and I don't wake up feeling rested. I still wake up 3 to 6 times during the night, toss and turn, and wake up feeling exhausted, like wanting to take a nap all day, wanting to get into a hammock in the middle of the day and sleep for 3 or 4 hours, just to recharge, just to feel normal during my day. Then add on to that the pills that you take throughout the day to get you through the day. You're walking in this constant fog all day, every day, and I don't see an end in sight. I've already been through almost through everything short of a surgery. Right now they want to send me to maybe do some aerobics in a pool to see if that will help. I'm not so sure. I've heard some positive things about doing rehab in a pool, that it does help ease some of the pain, but they seriously don't want me to get a back surgery until I'm past my mid-30s, if it's necessary. Right now they just want to concentrate on pain management, and basically they throw up their hands and say that, hey, that's the best we can do for you right now. Give you some pills, keep doing your stretching exercises, keep doing the ultrasound therapies. But I've dealt with this pain long enough that I'm seriously considering going under that knife to try and get better, to try and do things that I used to be able to do, like play football, play basketball. Those were my hobbies, those were my sports, especially back in high school and middle school. It kind of makes you feel like when you're going through these kind of injuries and conditions, chronic conditions, kind of makes you feel like your life is over before it really truly started, because you're limited on what you can do. Anyways, that's all I got to say on the subject. Let me know your opinion or your advice in the comments below. ADR King Black.